Now to our CBS News medical contributor, Dr. David Agus. You just heard in Lilia's piece these mandates that are going into effect. How quickly do you think we'll see a difference? Will these mandates work?
They have to work. They're the most aggressive step yet, mandating that every federal employee and federal contractor, as well as healthcare worker, are vaccinated. And 80 million people will either have to have a vaccine or a weekly test who work for companies of more than 100 people. Unfortunately, there was no other way to get above that low 50%, which is where we are now in terms of vaccinated in the country. We are the lowest of the G7 countries. Japan has passed the United States in terms of vaccines. So we have to take drastic measures to get the vaccination up in the United States.
We keep hearing about this Mu variant, Doctor. Is that something we should be concerned about right now? What is it?
So the Mu variant originated in Colombia in January. It is here in the United States in 49 of 50 states. It peaked about 7-8 weeks ago. It's a little bit lower now in terms of incidence across the country. We think the vaccines are working to prevent serious illness, so it's something we're keeping an eye on, but there's no reason to be worried at the present time. But we're going to follow it literally on a daily basis.
Some good news recently, the CDC noted that having these vaccines dramatically prevents hospitalizations and deaths. With that type of information, do you think it will change the minds of people who continue to refuse to be vaccinated?
You know, I hope so. I mean, unfortunately, many of them, it's their belief system, it's not data. But as we get more and more data that are remarkably compelling, that the vaccines work, they prevent serious illness almost uniformly, and at the same time are remarkably safe, it has to step up our vaccination rate in the country. I sound like a broken record, but we have to do it.
All right, Dr. Agus, we appreciate the information.